All right, so we got a smile on our face, so that's always a plus. All right, so let's stand right over here. Hold on. And if I were to ask you, if you could just one of you guys stand behind him, just to make sure. And all right. And if I could just ask you, just to say, can we squat down at all? And just could you squat down just to see if we can make any kind of range of motion there, to see if we can move. Just see if we can move. Okay, just squat down for me. Mm-hmm. Now, I want you to tell me in your own words, what do you think about that? Because you could not even move before, and you could almost squat down and touch the floor, and that was one treatment, right?
One treatment.
Okay. How does that make you feel?
Yeah, great. I feel like hugging you.
I'll hug you in just a second. Now, and patient, and you've had a knee replacement.
Yes, sir.
Came in here in a brace. This was one treatment, and I tell patients it's an honor and a privilege to be here.
More than you can say, it's an honor just to be with you. I hate to say this, but you're my favorite doctor. I'm gonna. It's just it's what it is.
I hear that a lot. So.
Like he goes,
I mean, I am a modest person, but hey, but thank you. Thank you.
Oh, there's enough love to go around.
That's it. It is.
Well, everyone, I'm excited, and again, thank you again. Today, we're gonna again talk about stem cell, but before we do, I'm gonna talk about some of the accolades on what Dr. Barlow has accomplished. To be honest, I had like 4 papers, so I'm gonna just sum it down, everyone. So first, Dr. Barlow is a board-certified chiropractic neurologist. He's a fellow of the American College of Functional Neurology. He trains doctors all over the world, from Italy to New Zealand. He is also an AFNI seminar instructor. He is also a lead U.S. instructor for Trigenics, specializing in knee and shoulder problems. Dr. Barlow is also a national and international speaker, also a keynote speaker at multiple conventions.
We welcome you, Dr. Barlow. Thank you.
Thank you.
Oh.
Thank you.
So how did you get into stem cell therapy?
How did I get into stem cell therapy? Actually, the actual first person that I know personally that did stem cells was my wife.
Hi, I'm Cindy Pruitt, and I had stem cell injections 2 months ago. I had went to Dr. Barlow's seminar and decided that was what I wanted to do. I've had back trouble for 33 years, and it had started, my hip had started hurting, my knee had started hurting. My pain was around 8 most of the time. 2 months ago I had the stem cell done, injections, 2 in my back, 1 in my knee and 1 in my hip. 2 weeks ago my knee has quit hurting altogether. My hip hurts very little, and my back is, the pain level is a 3. I'd recommend it to anybody if they had the results I've had, and I'm hoping to get better as time goes along. And Dr. Barlow and his staff is great, and they'll take good care of you. And if you are hurting as bad as I've hurt, and it works for you, it's definitely worth having the stem cells done.
And what is the one thing, Ms. Pruitt, that you're able to do right now that you just almost couldn't do, or it was impossible to do before you came in?
Well, I got where I couldn't walk very far without having to sit down because the pain was so bad, and I couldn't stand very long at a time because my pain had gotten so bad. Now I can walk a lot further. I can stand a lot longer. I'm doing some of the things at home that I couldn't do.
Like what are you able to do?
Well, just general stuff, picking up stuff. You know, it would hurt if I picked up something over 10, 15 pounds. Now I can pick up 25 and it doesn't hurt. Also, when I mopped, it would just kill my back to mop. I've started mopping again, and it's not hurting, and I'm not having to sit down.
What did your husband think about these results?
Oh, he's proud that I went and had it done. He was the one that actually saw it in the Daily Journal and asked me to go to your seminar. And I'm proud that he saw it, and then we went to your seminar, and then I had it done. My family, the whole family's noticed. My sister was talking the other day. We went to shopping, and she looked over at me and she said, "I can't believe how much better you are." She said, "You hadn't sat down the first time."
Yeah, and you've seen multiple people, a lot of people in here who have had stem cell injections, so you realize you're not Just one. You're one of many.
I'm one of several, that I've talked to several since I've been here, and everybody else seems like they're having good results too. And, they want to talk about it too and tell how much better they feel. And, like I said, if it helps people like it's helped me, I highly recommend it. And your staff and you have been, y'all are the top, y'all are trying to get people better.
Well, thank you very much for this information. You really are going to change some people's lives by them seeing this. Thank you.
Thank you.
My name is Jeff Rollins, and I've been coming here for a couple of months, and it's a fine place to come. I went to Memphis to a clinic up there, and they wouldn't do nothing for my knees. Said I was too old. I'm 91 years old, and they said they wouldn't put me to sleep. And I came here, and they've done a wonderful job on my knees.
And Mr. Rollins, could you tell everybody what you came in for?
I come in for wore out knees.
Your knees were wore out, and how bad were they, would you say, on a scale of 1 to 10?
I'd say there's about a 9.
Okay, and a 9. And how long ago did you get your stem cell injections?
Oh, it's been 2 months, I guess.
2 months, and how much better are you now?
I guess 1% right now.
So you went from a 9 down to a 1?
Yeah.
Okay. Tell everybody what you can do now that you had difficulty doing before coming into the clinic.
Oh, I can walk without using a walking stick, and it don't pain my knees. My knees was paining me before, but they don't pain me now.
Okay, so you can pretty much walk anywhere you want to walk?
Oh, yeah.
Okay. Did you have problems walking upstairs or downstairs before?
Oh, I couldn't hardly walk upstairs at all.
Okay, and then how's that doing now?
Oh, I don't have no trouble.
No problems at all. And if anybody was watching this, and I give free stem cell seminars, and you came to one of mine, I believe you came to one in Tupelo.
Yeah.
And what would you tell people that's watching this video? Would you recommend that they come to my seminars and learn about stem cells? And I mean, what would be your opinion on this?
I advise you to come to them seminars and get more educated on what they do for you, and they'll help you.
And you've seen several patients, multiple patients in here who have had these injections, and it's really been almost to the point of life changing for them.
Yeah, the interjection they give really paid off.
Yes, sir.
I'm proud of them.
Yes, sir. And thank you very much, Mr. Rollins.
Glad to come in, and thank you for letting me tell them people about it.
Yes, sir. Yes, sir. You're very welcome.